Well, a warm welcome to this talk. Now, I've had lots and lots of questions about how I chose to manage myself during my recent viral infection. Now, there's four main viruses around in the UK and indeed in the whole Western world at the moment. In fact, all of the world where it's cold and wintry, where these viruses have a higher prevalence or really a higher incidence, where we get more new cases of viral infections. So there's COVID, of course, that's still around. There's influenza, particularly influenza A, the one that spreads around quite dramatically, as we know, in wintertime. RSV, respiratory syncytial virus, which affects mostly young children, but can affect people of any age, although they tend to have a much milder illness. And the one I suspect I had, which is a human metapneumonia virus. So that's the one I suspect I had. But these are all viruses, and the management strategies for all four is really quite similar. So the way I manage myself would have been basically the same for any of these infections. Now, I didn't dwell on this last time because YouTube don't like it if I start talking about medical treatments. So I stress this is not advice for you. This is merely a historical event of what I did for myself. So let's look at that in a little more detail and see what we can learn academically from this. Now, this was my management strategy here. Now, the first thing is I took Calcifediol. Now, this is my Calcifediol here. The doses are 0.266 milligrams in this particular preparation. That's 266 micrograms, and that relates roughly to about 11,000-ish units of vitamin D. Now, the obvious question is, where did I get this? The answer is I simply walked into a pharmacy and asked for it, but I was in Spain. And now in the United Kingdom, we're not allowed it. Now in Spain and Italy, you can buy it over the counter. So if someone you knew or yourself happened to be on holiday in Spain or Italy, perhaps other European countries, but Spain and Italy for sure, you can simply go in and buy some. And I bought 10 of these capsules of Calcifediol, and it cost me, I think it was about 11 or 12 euros. So that works out at about £1 sterling, $1.20 per capsule. Now, the question is, why did I take Calcifediol? Well, if you're already replete in vitamin D, you probably don't need Calcifediol. Let's remind ourselves briefly of what goes on in this situation. Now, what happens is we take D3. So D3 is the form that you get in nutrition, or the form that you get from the sun, from your skin. But that's not the active form. That has to go to the liver. And in the liver, over a course of about 2 weeks, that's converted chemically into Calcifediol. And this goes into the blood, and this is the reservoir form. So this is in the blood should you need it. Now, if you've taken plenty of vitamin D 2, 3, 4 weeks before, and your blood levels are already topped up, then perhaps you shouldn't really need this. But there is an argument for taking it as well, because the body uses vitamin D up very rapidly when we have an active infection. But when I look back, when I got my infection, I thought maybe I haven't been taking my vitamin D as much lately, so I topped it up. Now, if I topped up with vitamin D3 that you buy from the supermarket in the UK, then that would have taken a fortnight to work. But if I take this works within a couple hours. This actually works quicker against infections than do antibiotics, which can take several hours to work. So what's happening is that the liver is converting the ordinary D3 to Calcifediol, and we're bypassing that stage, saving 2 weeks, and this will start working straight away. And you might remember this if you've watched the lectures with Dr. David Grimes. The Calcifediol, that's the reservoir form in the blood. When that's taken in by the white blood cells, that's converted to calcitriol. So when the white blood cells are getting an infection, they need to activate their genes. To activate their genes, they need vitamin D3 in the calcitriol form, and this Calcifediol is converted to calcitriol in a couple of hours, and that activates the the white blood cells, and they can increase their activity when they're activated by a factor of about 50. But they can only do that if they have enough, of this. Now, if we're short of this vital substance, then the vitamin D receptors can't combine with the calcitriol, they can't activate the genes, and we don't get normal expression of the white blood cell activity. So if you visit Italy or Spain, you can just buy it over the counter, way cheaper than the NHS. The NHS, you can prescribe, the doctors can prescribe it, but only one at a time. But we can't buy it over the counter. So clearly, lives in Spain and Italy are more important than the unimportant lives in the United Kingdom, because we are denied what can be, in my view, and in the view of many experts I've talked to around the world, leading consultants and professors, a potential life-saving intervention, especially if someone is low in vitamin D to begin with. So the lower someone is in vitamin D and the blood levels of vitamin D, the calcifediol in the blood at the start of the infection, the more effective this will be. But also remember, as Dr. Grimes told us, very important to remember that I wasn't fully aware of myself, I must say, that the calcitriol can only be used by the vitamin D receptors once. It's like ammunition. Once the bullet is fired, you can't fire it again, and you need to keep it topped up. This is why this is the reservoir form. So I've taken 3 of these so far. I took one day, then another the next day, another after 3 days, I think, and I'll probably take another one today. And that's what I did. So there you go, Italy and Spain, no problem at all. United Kingdom, tough ched, you're not important. So trouble is, when you're in Italy and Spain, it tends to be warm and sunny, so you might not remember to get it. But plenty of people are going back and forward where it is available relatively cheaply over the counter, the activated form of vitamin D, the calcifediol. Now, moving on. Now, I did actually take a drug beginning in I. I can't remember its name now, but I think it ended in tin. Yeah. And the reason I took that was in case I had COVID, because at the beginning I wasn't sure if I had COVID. And so I took some of that drug beginning in I. Wish I could remember the name. Anyway, it's the drug that dare not speak its name. But I took some of that. I took 2 12-milligram doses. Then I thought I didn't have COVID, so I didn't take any more of that. Now, this drug beginning in I, that I can't remember its name, it would be really useful to have some thorough investigations to see if it is effective against other viral infections. Because at the moment, I'm personally convinced it's active against COVID in the acute phases. But I simply don't know about other viral infections. But it's cheap, so no one's going to bother. Unfortunately, vested interests aren't going to bother with that. In fact, vested interests are probably going to carry on actively suppressing that. And the same with this. Why on earth wouldn't we want to optimize everyone's immune system? We've got the NHS is full of patients. The hospitals are overwhelmed with this completely predictable, well, not overwhelmed, but it's full, and people are struggling with this completely predictable winter flu, COVID, meta-pneumonia virus, RSV, excuse me, a pandemic or epidemic, great outbreak that we have in the UK, at least epidemic, but completely predictable. But why wouldn't we want to optimize everyone's immune system so that less people were hospitalized, less people got sick? Why wouldn't we want to do that? Why wouldn't the government want to act in the best interests of its people? Very strange indeed. Now, the other thing I did was I took vitamin C. Now, again, you can look up papers that give evidence for vitamin C. You can look up papers that say vitamin C doesn't do much good. But I took an extra gram of vitamin C a day for about 3 days. And as long as you're drinking plenty, it's hard to see that it's going to do you any harm. Some people take even higher doses than that. But as long as you're drinking plenty, any excess will simply be washed out in the urine. And vitamin C, as we say, some people do suggest it helps with some viral infections. So To me, it's always about risk-benefit analysis. If it's not going to do any harm, then what the heck? If it's not going to do any harm, try it. If it helps, it helps. Wonderful. Now, vitamin C. Now, quite a few people have suggested taking, zinc. Moving on to zinc. Quite a few people have suggested taking zinc lozenges, which seems like a good idea because zinc is needed in the cytosol of the cell to facilitate antiviral activity. And if you've got lots of viruses in the back of your throat, in the oropharynx, for example, where a lot of these infections are, then the zinc may have some direct effect. I've certainly worked with nurses who use zinc in wound healing, and they believe it has antibacterial properties and helps wound healing directly by its direct absorption into the wound, helping the regeneration of the wound, because we know that zinc is essential for wound healing. But also zinc is needed for protection against viral infection. So it made sense to take adequate amounts of zinc. And personally, I tend to take about 15 milligrams of zinc a day, 15 milligrams of zinc a day. Now, this is just me personally. I don't take it every day because sometimes I forget. So I probably take it about 5 days a week or something like that. And the reason for that is there's a lot of data that is good for the prostate, which at my age can become enlarged, of course, with benign prostatic hyperplasia. And there is some good evidence that I've read that suggests adequate amounts of zinc reduce the probability of developing prostate cancer. But that's a separate matter. But to make sure that people are zinc replete, again, is a good idea because zinc is an essential antiviral element needed for the body's natural antiviral immune system. Now, the dilute iodine gargles. Again, it's very hard to buy iodine in the United Kingdom. Chemists don't sell it. Why on earth wouldn't chemists sell iodine? Iodine kills all known viruses and bacteria. Now, of course, the trick is to get the iodine into contact with the viruses and bacteria. But when I worked in theatres, we did a lot of studies on the antiviral, antibacterial spectrum of various agents, for example, hand washing, antiseptics that were used in the theatre, and iodine, because we use betadine, of course, for wound cleaning. But iodine kills all viruses and all bacteria that were studied. So very, very effective. So I get Lugos iodine 15%. You can buy it online in the UK. You can't buy it at a chemist in the UK. Quite incredible. Excuse me. You can't buy it from a chemist. Absolutely ridiculous. But there you go. That's the Nanny State looking after you to keep you ill. So I got 15%. It's called Lugos iodine after Dr. Lugos, who's the 1820s French physician who developed it. And I just put some drops in, about a mil of iodine to a large glass of water and just gargled it. And again, it makes sense because, the iodine vapors are going to go through the nasal passages down into the lungs to an extent if you gargle. And also directly come into contact with the viruses in the back of the mouth and go straight into the oropharynx, nasopharynx, laryngopharynx, down into the trachea. So to me, that made sense to do. And you can do that when you get round to it. I remembered about 3 or 4 times a day, perhaps. Is the iodine going to do you any harm? Well, again, in Korea and Japan, there's been studies done that show people take about 12 milligrams of iodine a day because they eat lots of seaweed, because seaweed, especially kelp, is remarkably high in iodine. And all you find is the more seaweed they eat, the more iodine they excrete in the urine the next day. So again, it's homeostatically regulated. And of course, the thyroid gland needs iodine to produce thyroxine, which is essential for supporting pretty well all forms of metabolism throughout the body. So I wasn't vaguely concerned about iodine toxicity. Why the chemist won't sell it to me, I'm not quite sure. Why it's restricted in my country, it just doesn't make any sense to me whatsoever, but that is the situation we are in, unfortunately. Granny knows best. So dilute iodine gargles. Now, avoiding antipyretics. Now, antipyretics, so Tylenol, acetaminophen, paracetamol, Panadol, it's all the same drug, lowers body temperature. And it does this by affecting the the chemical balances in the hypothalamus in the brain, the prostaglandin balances in the brain. But the point is, the prostaglandin balances in the brain are increased to deliberately increase body temperature. So when you have a fever, that is not a side effect of the disease. It's not a symptom of the disease that you have. It is the body quite deliberately increasing its body temperature. And the body quite deliberately increases its body temperature to generate a pyrexia or a fever. It's all the same thing. It's quite deliberate because that optimizes and increases the function of the immune system. And also, as the body temperature gets hotter, it makes the environment for viral replication and bacterial division less favorable. So the fever is weighing the odds greatly on the side of the body, greatly boosting the immune system. Really quite a significant effect. And if you take antipyretics, if you take ibuprofen, aspirin, paracetamol, acetaminophen, that's going to lower your body temperature. That's going to make it easier for the viruses and bacteria to multiply. That's going to keep the conditions for viral multiplication optimal. And it's also going to prevent your immune system from gearing up to increase its activity through the pyrexia to more effectively combat the infection. Now, it will make you feel better, but of course you're supposed to feel ill when you're ill. That's the whole point. That's your body trying to protect it with this cytokine pyrogen response, which is highly protective. Now, I'm not talking about children here. People always say, well, what about children? This talks about me, and it may have some educational applicability to other adults. Children can have different reactions, and children below the age of 2 can't control the body temperature. It's a completely different situation. We don't want children below the age of 2 having fevers, generally speaking, but consult your doctor about that. I'm not going to go in that today. It's a complicated subject. So I avoided antipyretics. Rest and sleep, of course, is absolutely vital. Sleep is good for absolutely everything. So any rest you can get, any sleep you can get is good. Also, when you're ill, it's very inadvisable to exercise. You don't want your heart muscle to be exercising. You don't want any muscles to be exercising, really, when you're ill. You really need to rest. I've come across people with great bravado saying, oh, I've got a cold, I'll just run it off. It's actually quite a dangerous thing to do. You can damage your myocardium by doing that. And I've actually come across people who've had cardiac arrests while exercising, thinking they could run off a viral infection. When I was working on coronary care, we did come across this occasionally, and it's a pity because it's a completely unnecessary thing to happen. So rest all you can, sleep all you can, and then when you're feeling better, your body will tell you when it's time to get moving again. Light nutrition and protein is important. Protein, of course, excuse me, still cleaning up some secretions. Protein, of course, is what the antibodies are made of, the immunoglobulins. They are proteins, so we need adequate protein supply. And also, when you're ill, tissues will be damaged. So to maintain tissues and to promote healing of tissues, then adequate protein is essential. Protein, you also need vitamin C for it to work properly, and you need other adjuncts for it to work properly as well. So thinking about a diet that's probably lightish if you don't feel like eating too much, but as soon as you feel up to it, eat food, but eat healthy food. Don't eat a donut. Eat something that's light and healthy would be my thinking. Keeping warm, of course, is essential because that keeps the immune system in shape, optimizes it. If you're cold, the immune system is not going to work as well. So I went with my pyrexia. So when I was feeling cold, that's the body trying to warm you up. Fine, wrap yourself up. Then when you get to the set point that the hypothalamus wants you to be at, then you'll stop feeling cold. So feeling cold, again, is a defense mechanism. So sit by the fire, sit by a radiator if you can afford to run one, and put on warm clothes until you warm up. That's what I did, until your body temperature is at the set point. So like my temperature went up to about 38.5. I think that was 101.5 or something like that in Fahrenheit. And you feel cold till you get to that. When it gets to that point, then you're at the set point that the hypothalamus wants the temperature to be at, and then the temperature is at the set point the hypothalamus wants it to be at, then you'll stop feeling cold, which is good. And of course, keeping well hydrated is absolutely vital. You want to clear these secretions from the nasal passages, from the sinuses, cough up all these secretions from the lungs. The mucociliary clearance system that does this wafting up, well, if you dehydrated, the mucus will become thicker and it will become much harder to do. It will become more viscous, what we call more tenacious, harder to get out. So keeping hydrated keeps the mucus as thin as possible, so it's easier to flick out, and we can expectorate. We can cough it out, and always cough out what you can. So coughing is good. Blowing your nose to get rid of all the gubbins is good. So I'm going to leave that one there for now. We'll see if that is allowed. As I say, purely for academic interest. I'm not telling you what to do. That is purely what I did. But we'll leave that for now and see if we're allowed to say that. And then we'll come back and I want to look at a bit more detail at the human metapneumonia virus as well. But we'll leave that one there for now. So for now, thank you for watching. And if you are ill, do get well soon and take care of yourself. And thank you so much for all the well wishes I got on several thousand comments. It really is quite touching and moving. So thank you.